Hello YouTube family, this is Tasha with Getting Back to the Real Tea. I am coming to you today for my, this is my 15-week review. I just had my 3-month post-op at my surgeon's office. And so first things first, my current weight is 194. Woo! I'm so excited. I haven't been 194 in so long. Oh my gosh, I'm so excited. So that's a milestone. But anyway, 194. And for you who have just joined, my highest weight was 245, and my surgery weight was 233. And I did my pre-op, and I got down to 233, and then now I'm 194. So I'm excited. Great time. I am finding that I am fitting a lot of 12s in my closet. I have every size in my closet. Well, I have till size 8. Last time I lost weight, I got down to a size 8. I've always, when I was younger, I've always been like a 7, 8. My lowest, when I was a teenager, was 5, 6. So I still had clothes from when I got back down to an 8. So I'm still shopping in my closet, which is fun. I am gonna have to go shopping though, but it's fun. So I'm just excited that I'm able to get back into those clothes, jeans, pants, whatever. Some things I brought years ago, and it was supposed to be my motivation to lose weight because it was so cute, but it didn't work. So, but now I'm able to wear it, so it's cool. And so at my 3-month appointment, I saw the nurse practitioner this time. If you remember a few videos ago, I think it was my 6-week post-op, I saw the PA, and I didn't like the appointment with her. I felt like she wasn't knowledgeable. Same thing for the nurse practitioner. This is a male. I feel like, it was just, how's everything going? How much protein are you getting? How much are you drinking? Are you taking your vitamins? Okay. You have any questions, any concerns about, your weight loss so far? And when I say, yeah, I do, my one concern is, and I'm sorry guys, but ladies, I'm sure you'll understand. I had a tubal ligation when I was in my 20s. And ever since then, I've had horrific, tremendously painful cycles. I was told it's scar tissue or whatever. So during that time, I used to take mad Aleve. And it, at some point, I even took prescription medicine. And then I injured my back in, it started around 2003. I was injured at work, and then it was just continuous things happening at work and just continue to injure my back. I worked at an outpatient surgery facility, and we did procedures for patients with back problems. So, the patients would be heavily sedated, and because of that, I'm helping them off the table and, helping them back to the dressing room and things like that. And I'm trying to, help them because I'm the only person there. I assist the physician with his exams, and, I'm really the only person back there clinical to help them. So I would help them, and I ended up hurting myself with the patients. And so that spun another wave of pain, and then it made the cycles even worse with having a back injury, and then taking pain medicine, and then being immobile most of the time and not being able to work out and really do much of anything. That's when I really packed on most of my weight. And so I was telling him, okay, since I've had surgery, I can't take the anything but Tylenol, and that's over the counter, and it doesn't do anything for my cycle. So I said, well, in pre-op, we were told that before we take any medicine from another doctor, to make sure that, we talk with Dr. Kim's office and make sure that it's okay, because we don't want to, burn a hole through our sleeve or whatever, through our stomach, so that, you just be safe, because he knows what you can take, and a lot of doctors may not be versed on, the sleeve and what medications you can take. So that's what I did. I said, well, I need to know what I can tell my GYN to give me so that it can help me, with the pain, because I'm down like 2 days. I can't be off every month for 2 days. And he acted as if he didn't know what I was talking about, and was like, oh, well, Tylenol should be fine. And I'm like, look, Tylenol is not fine, and I'm going to need to know what else I can tell them. The tramadol that I was given at surgery, I took some of that. It doesn't touch it. So I'm sleeping with the heating pad. I'm walking around with a heating pad. I'm popping way more Tylenol than what you would want me to take anyway. So I just need to know what I can tell somebody prescription strength. He just really, I don't know if it's Florida, because Florida is horrible when it comes to drug seekers, and the doctors just treat you like everybody's a drug addict and drug seller. They just want it so they can sell it, or want it or because they're addicted. When I was in Georgia, I didn't have that type of problem. You got records showing you have a back problem or whatever, and they gave you what you needed. I'm not selling anything. Anybody that knows me knows my pain during that time, and they know I need my stuff. So, plus I don't get anything that's, I would think, marketable. I can't do any hydrocodone or anything. I ever work. But I'm just saying I need something more than Tylenol, and he didn't get it. So, I really had to get a little irritable with him and just really speak my mind. I had to speak clear to him, that so that he can understand. I'm here. I had the surgery. I'm doing what you all told me to do in pre-op, which is come to you first. And there's no way you can tell me that other, 30-something, 40-year-old women that's, in my age range or whatever, that's still menstruating, that has had the sleeve, has ever come to you and asked about what they can take for their cycle pain, because it's that bad. You cannot tell me that you have no information on this. Now, if you don't have any information on this, you need to go speak to somebody who does, because somebody needs to tell me something today, because it's not working. So basically, he left out of the room. He came back and said, you can take tramadol, just have them give you a stronger strength. So I'm going to speak with my GYN about it and, ask them. But ladies, if you all have any information about this, if anybody has, experienced anything like this, that they've had bad cycles, and after their sleeve they had to figure out something new to take, please let me know. Please, send me a message, because I need to know. And my stuff is bad, and I don't care to be in pain like that. Tylenol doesn't touch it. Even just regular women, normally Tylenol doesn't do anything. We take Motrin or whatever, or even something else, but Tylenol, seriously? So let me know if you have any input on that for me. I'm not going to go on about that too much more. But at any rate, he was pleased with my weight loss. Felt like I was on track. I feel like I'm losing a little slower than what I've seen people do, but I know that everybody's journey is their own. And bottom line, I feel like I've lost slower, but I'm happy with the results now. I feel like I can really see the progress, feel the progress, and I'm happy with that. So that's a good thing. The other thing is, I've been seeing the videos where everyone's doing why do they make videos. So I just wanted to touch on that. I moved here to Florida 2.5 years ago, and prior to moving here, I remember just feeling like I didn't know what to do about my weight. I was just gaining, and nothing was happening. And, I tried every diet, nothing worked, and just really discouraged. And just before I left, my sister told me one of her friends had the lap band. And I was thinking, oh, that's nice. That might be, something to think about. Well, at the time, our insurance in Georgia didn't pay for the lap band. So my husband and I had decided that we were going to move to Florida. And he had received an offer from a hospital here. He received the offer from a hospital here. And so in their benefits package, I remember reading that they pay for weight loss surgery. And so before I even left Georgia, I was like, oh, let me see about this lap band. So I found out that they do pay for it and everything like that. So when I got down here, I kind of inquired about it, but you had to be on the insurance for 2 years. So during that 2 years, all kind of stuff happened. Of course, more weight gain. But I got to the point, I was a year into the insurance here. And, I tell my husband, if I don't lose weight by the summer of 2013, I'm going to have the surgery. And, September is when I qualified. So basically, I didn't lose the weight. And I started doing research. And I went to a weight loss seminar at the hospital here in Florida Hospital. And so I went to the seminar, I listened to what they had to say, and then I got on YouTube and I started, looking at people, researching and everything like that. So basically, after all of the research that I had obtained, I realized that, the sleeve was best for me, and the sleeve is definitely one of the surgeries that the hospital paid for. They actually paid for the lap band, but the bariatric center at the hospital was moving away from it. They didn't even want to offer it. So it was kind of like the sleeve or the Roux-en-Y. Well, after so much research and listening to so many ladies, I connected with so many ladies on YouTube with their stories, with how they gained their weight, how they lost their weight, the different things, how they broke down the whole process and their, how it worked for them. I felt like if I go and have this surgery and I've utilized their blogs, their stories to help me feel comfortable and to prepare me for weight loss surgery, I felt that I would be doing an injustice to someone else who may be able to relate to me and my story and the things that I am encountering during my weight loss journey. And so I felt like I needed to give that back, what I had gained from so many other people. So that's the main reason why. Believe me, it was a hard decision to come to, because it was, I had to be transparent and I had to talk about, my weight. I had to admit, and then I have to talk about when I don't lose weight, why I didn't lose weight, what I was eating, what I was doing, whether I'm working out or not. And it does, it's challenging. It puts you in a very, vulnerable position, because people are going to respond. People are going to give their feedback. Everybody's not on here to be encouraging. Some people, are just leaving mean, nasty comments and, always have something to say, negative. So many negative people you wouldn't even believe. But I'm not here for those people. I'm here because I just want to tell my story, and hopefully somebody, maybe someone here in Florida. I hadn't seen a lot of people in Florida on YouTube. So I don't know. Maybe a lot of people in Florida don't know that this is out here. Maybe, you know, a lot of people that work in my area in Orlando, or, you know, somewhere in the vicinity, they maybe don't know that there's hospitals that offer this surgery. I don't know, but I just felt like I needed to share and encourage others just like they've encouraged me. So that's why I make videos, and it keeps me accountable, because when I come on here, I got to tell y'all what I've been doing. And, you know, I have subscribers that I follow them, they follow me, and so when I make a comment on theirs, they're making a comment on mine. And, you know, if I'm not doing something, I'm sure they're gonna say, "Girl, what happened?" You know, so that's what I need. I'm not really, you know, shy about saying to anybody that I've had the sleeve. If they ask me, "Girl, what are you doing?" You know, I pretty much will tell everybody that asks. I don't just shout it from the rooftop or anything, but if they know me and they say, "Girl, you've been losing weight, what have you been doing?" I'll share with them. And I'll even share, you know, if they're thinking about getting weight loss surgery, which a few people that I know have, and they've watched my progress. And I've even shared with them while I'm on YouTube. I do a blog on YouTube. So, and there's some other people on there you might want to look at. And it was one guy that he's thinking about having the Roux-en-Y. And I told him, well, you can look at mine, but there's some other guys that's on there that's had weight loss surgery, and you know, maybe their story can help you and encourage you, or give you some information that maybe as a woman I can't tell you how it worked for, you know, a male or whatever. So that's why I do videos. So anyway, I'm already at 16 minutes. They might reject this because that's what they did last time. But anyway, just want to thank all of my new subscribers. Thank you for subscribing. I look forward to sharing in your journey as you share in mine. So anyone that is subscribing to me, I'm going in and I'm subscribing to you too as well. So and also to my already existing subscribers, thank you so much for your encouragement. Thank you for everything. Guys, if you want me to answer any particular question, put it in there. I will do so. And hopefully, you know, I'm going on vacation in July, so my goal now is to be 175 by July 16th. So let's see if I can do this. Hold me accountable. Check on me. Make sure I'm doing what I need to do. Because, look, I'm fighting carbs. Just like Ray P said, I'm fighting carbs too. I like my chips. And I will have a couple. I found the Skinny Pop. I love it. I like the plain more than the cheddar, but I like that, and I'll have a little bit of that. You know, I like my little Cheez-Its or the little goldfish crackers. I mean, but I try to do right as best I can. But hey, every now and then you want a little carb, so I'm just keeping it real. But all right, guys, thank you so much for watching, and talk to you later. Bye bye.